time for Can Fasting Save Your Life? A Q&A with Dr. Alan Goldhamer, the co-founder of the TrueNorth Health Center and the co-author of this amazing new book, which you have to get. And he's going to talk about whether or not fasting can help you and answer your questions. Please welcome him to the show. Hi, Dr. Goldhamer. Haven't seen you since Sunday. How have you been?
Good morning. Yeah, we had a wonderful time at your event this weekend.
Well, thank you so much. You know, we had one of our speakers had COVID, and I called you at 5 in the morning and woke you up, and you so graciously agreed to give a presentation based on this book, which was really well received. So, you know, even though I have 3,000 YouTube videos, not everyone watches every single one. This could be the first time somebody hears about you. So maybe you could talk a little bit about the book and what you do at the TrueNorth Health Center.
Well, we're really excited about this new book that just came out called Can Fasting Save Your Life? And it's an unusual book because it's based largely on the 22 papers that we've published in the peer-reviewed scientific literature on our work with diet and fasting and treating a variety of conditions at the TrueNorth Health Center. And it has all the information people need to know to really understand the history and application of fasting, and also for their doctors to understand the things necessary to safely determine who's a candidate for fasting and how to provide the testing and monitoring that's needed to make sure fasting is done safely and effectively. So, you know, we brought a lot of really good information together. And fortunately, Dr. Myers, who is our director of research, has a really unique skill. She can take complicated things and make them understandable. And so she's written this in a format that is, you know, useful for the layperson, but also convincing to physicians that fasting, you know, may actually have utility.
Nice. Why aren't there more fasting centers, you think? Because you're one of really the only ones.
Well, there's lots of places that do modified fasting and fasting mimicking approaches that are, you know, out there. They tend to be shorter duration and higher price point, so they're kind of a better business model. Water-only fasting kind of is a tough pitch because you're asking people to do things they don't really want to do, and you have to do it for a long enough period of time to get success. So it doesn't lend itself to the, you know, weekend spa type experience, but it does require, you know, a fairly high degree of supervision. So I think what happens is it's just not as attractive as a business model. It's like having a restaurant that serves people healthy food rather than greasy, fatty, slimy processed foods. People go out, they want to have stimulation of their dopamine cascade. They don't want to, you know, eat healthfully. If they were going to eat healthily, they could have eaten at home. So they're going out for a, you know, a celebration or a special treat. So I don't think you'll find as many restaurants focusing on giving people whole plant food, SOS free food, as much as you will giving them salt, oil, sugar, saturated animal-based products. Giving people.
You there?
I am.
Good. Yeah, your sound just glitched for a second, like a second.
You're frozen up on my screen. I don't know if that's true for everybody.
Oh boy. So maybe viewers, maybe you can tell me in the chat whether I am frozen for, I'm back.
Oh, you're back.
Through the magic of turning the camera on and off. Yeah. So would you like to, is there anything you want to talk about or promote, or do you want to just jump right into the questions?
No, I'd be happy to go to questions, AJ.
Okay, well, so Dr. Goldhamer, after you did your fabulous presentation, you did a joint Q&A with Dr. Doug Lisle, and we promised the people that attended the conference that we would ask their questions first on today's show. So we'll get through as many as we can. And I know how you'll answer some of these, but I'll start with this one. What are your thoughts about stevia and stevia versus organic maple syrup?
Well, the problem with both of these highly processed, concentrated sweetening components is that the things you're putting them on, usually you shouldn't be eating. The reason why people need to sweeten things is they've taken usually a grain like wheat or something, and they've processed it to the point where there's no real flavor left, and then they use it as a carrier agent to carry salt, oil, and sugar to people's palates. So the first question you should ask is, what is it you're eating that you need to sweeten? And then to argue, oh, well, stevia is less bad than sugar and that maple syrup's less bad than honey and honey's less bad than sugar or something is kind of a false argument. The real first question is, why are we eating things that we have to add sweetener to? It's usually because it's highly processed and concentrated, and you shouldn't be eating the stuff at all. There's nothing good about any of these sweeteners. They're just a question of how much less bad are they.
Well, you're very good at saying just
There's
because
nothing good about any of these.
you say often just because something is less bad doesn't mean it's good. Oh man, are you frozen now?
No, I'm not frozen.
Okay, I can
I
never
just
tell.
look frozen.
Yeah, exactly. So I don't know if you saw Dr. Roger Schwelt's presentation on Sunday, but he talked about advising against people taking a multivitamin. He was for people taking B12, of course, as I believe you are. But he said the problem with multivitamins is often you get things you don't need in amounts you don't need, especially copper and zinc. And so people wanted to know what you thought about Complement Essential. It's a plant-based vitamin that some of the plant-based doctors and influencers endorse, and it's a combination of B12, D3, DHA, EPA, iodine, K2, zinc, magnesium, and selenium.
Well, the good news is those are things that are in and of themselves not toxic. I'm still not a big fan of putting all these products together in a single capsule. My understanding is that there's challenges with that in terms of activation issues. And I'm also not a favor of supplementing things that aren't necessary, that most things you can get from your diet, including most of the nutrients that are in the multiple that you just described. And if you are going to supplement something, my preference would be to supplement just the amount you need of just the substance that you need. But I certainly appreciate the convenience and other issues and, the reasons why people do put multiples. And particularly, it's nice they're taking away some of the stuff that we already know is frankly toxic. Especially iron, vitamin A, other things that can be a really serious health threat. At least the substances you have in there, they may not be all necessary, but at least they're less likely to cause damage that some of the traditional supplements would. So again, it's one of those less bad things.
Thank you. Here's a question. Is the low sodium DASH diet effective to control high blood pressure? You have something.
Yes, the DASH diet is effective. I think we can sometimes do even better than that. But the point is that's a very good program. It's proven. There's good data showing that people that do the DASH diet do better than people that do most of the other programs. And recognizing that salt is a problem, not just for high blood pressure, but for also stimulating passive overeating and weight management, I think is useful. And it's probably one of the most accepted dietary programs in kind of conventional area that many physicians, have tried to encourage patients to apply.
Thank you. But you are doing a study or you've done studies just with fasting and high blood pressure and have had tremendous results, correct?
Right. The most effective treatment that's ever been shown in treating high blood pressure is the use of medically supervised water-only fasting, followed by a whole plant food SOS-free diet. We have the largest effects that have ever been shown. Our first paper had an over average drop of 60 points in stage 3 hypertension. We also have done it with borderline hypertension. Recently, we completed a prospective study where people were prospectively entered with blood pressure. 29 patients, 28 were able to achieve completely normal pressure without any medication. One required half their dose of medication. And at 6 weeks, we were able to show that people can sustain those results. And even at a year, 75% of those subjects were still able to have maintained their weight and normal blood pressure without medication. So at least highly motivated, self-selected people are capable of losing weight, keeping it off, and maintaining normal blood pressure without medications.
That's amazing. And you're doing another study, aren't you, this year?
We're planning to do a prospective, the first RCT, which is randomized controlled trial, where 90 patients from a local HMO with stage 2 hypertension will be selected. Half of them will be randomly assigned to standard of care. Half of them will come to the center and fast and get dietary instruction. And then we'll compare at the end of the year which works better, getting people well or keeping them sick.
Thank you. Here's a question on cookware. I know we're supposed to avoid Teflon pans, so what pan do you recommend? And what do you use at the TrueNorth Health Center, and what do you use at your home?
Well, we use we have induction burner at the center, And so we use commercial stainless steel induction cookware at the center. We even have stainless steel baking pans, which is interesting. You don't see those as commonly. There are some nonstick pans are available. In fact, we have one affiliate that's listed on our website that makes a brand of high quality non-stick cookware. And I think there's more and more of these bonded materials available now that don't leach. It's not like the old Teflon pans that flake off and give off gases and stuff like that. So there's also products out there like Steel On, and as I said, we have an affiliate that they can find on our website.
Thank you. Here's a question about prediabetes. There's actually a similar one on Instagram that maybe I'll hop over to. Dr. Goldhamer, I'm struggling with prediabetes. When I follow a time-restricted eating pattern and fast for 14 hours overnight, my fasting blood sugar is higher in the morning. Should I not fast this long?
Well, prediabetes is an interesting concept. It's like saying pre-pregnancy. I mean, you're a diabetic. You're just a mild diabetic. And the fact that your blood sugar is higher in the morning. This is after 14 hours of fasting. Was that what she was saying?
Yes, after 14 hours.
Okay, so hard to know exactly what to make of that, depending on what the pre-fasting meal is and all that kind of stuff. But typically, people are able to do 12 to 16 hours of fasting every day by limiting their feeding window, by not eating 3 hours before they go to bed at night, and over time, assuming you're getting progressive weight loss and you're eating a whole plant food diet, that should work well. Sometimes people will overeat on the meal before they begin to withhold, and that may be a problem. So what I would suggest actually is to go onto our website, complete the registration forms, and just give me a call. I'll be happy to talk to you and either try to help you solve the issue or at least steer you to a doctor that can work with you in detail. But there shouldn't be any reason why, if you do things right, you shouldn't be able to incorporate intermittent fasting effectively.
Well, let me jump over to this question from an Instagram viewer who's asking, if we don't want to fast, but we want to reverse insulin resistance, can you use a plant-based diet? And what would you include and what would you avoid eating?
Oh, absolutely. Yeah. Diet, sleep, and exercise are the keys. So you make sure you get plenty of rest. You exercise appropriately, particularly aerobically. And then you eat an exclusively whole plant food diet. You may have to limit the amount of fruit in the diet if your blood sugar levels are out of whack, or limit your fruit to maybe some berries and melon. No fruit juices, no dried fruits, no agave syrup, no honey, no maple syrup, no products with refined carbohydrates. And then really emphasizing salad and steamed vegetables. Beans have a lower glycemic response than grains do. Sometimes people eat a little bit more beans, a little less grains in order to help get short-term blood sugar control. Over the long run, though, once your insulin resistance is resolved, either with diet exercise and appropriately with fasting, you should be able to eat a whole variety of whole plant foods without having to have the level of restriction. Initially, when you have a lot of insulin resistance, you're going to have more trouble. At the time you get down to optimum weight, usually you're also getting down to a much reduced insulin resistance. And so sometimes you just have to work that extra diligence until you've actually eliminated the fat, and particularly the visceral fat that's producing the insulin resistance and the problem.
Thank you. Okay, here's a question. What would you say to a disciple of the Mediterranean diet?
Well, the Mediterranean diet may be a lot less bad than the traditional diets, and people on the Mediterranean diet usually have a better response than people on standard American diets. But there's still aspects of the traditional, or I should say the recommended Mediterranean diets, where they're making an error of attribution. They're thinking that the benefit is because they got olive oil in there or some of the other concentrated food factors, when in reality, the benefit is largely from all the things they're not doing on the Mediterranean diet, the lower animal food intake in general, the reduction in refined carbohydrates, the higher amounts of whole plant foods. If you really want to see what it feels like to get to your optimum health, try diligently adopting a whole plant food SOS-free diet and do that sufficiently long enough to get down to optimum weight and then see how you feel. Most people that do that don't say they feel better doing, some alternative compromised approach.
Thanks so much. Okay. Here's a question. During a water fast, do patients drink a specific type of water? And what about electrolytes?
Yes, electrolytes, your sodium and potassium are critically important issues. And during fasting, the body's capable of recycling these to a large extent. But that is a potential limiting factor of fasting. And that's why we monitor electrolytes carefully during fasting to ensure that people don't become dehydrated or get into a physiological problem.
Thank you. Okay. Is there a specific type of water you recommend in general for people just to drink?
Yes, as a matter of fact, we do. You want to get the purest water you can because people don't have a tremendous tolerance for, say, municipal water when they're fasting. And that's why we use fractionally steamed distilled water. We actually have a laboratory grade distiller that makes 50 gallons of distilled water a day, which we use to provide for food and cooking. You could use reverse osmosis if you had good membranes. There's lots of other ways you can use to get the stuff out of water that you don't want there. The most efficient, though, is probably steam distillation.
Thanks. Okay. Spinach is often listed as super healthy, but I think it's sometimes mentioned as not good for osteoporosis. What are your thoughts?
Well, the concern about spinach and chard and some of these foods is they're naturally higher in oxalic acid, which can be an irritant for some people if you eat too much of it. Generally, those foods are well tolerated. We use them abundantly with most patients. If you happen to have a food sensitivity, you can certainly avoid those foods without running into problems, but they're certainly nutrient-rich foods. So the concern is that although they're high in calcium, they're also high in oxalic acid, and they can bind. It's thought to bind calcium as a neutralizing effect. So I don't think it's a limiting factor. I don't think osteoporosis patients have to limit their use of green vegetables, including those vegetables, but certainly recognize some people have sensitivities.
Thank you. Here's a question, and we actually had a show right before, and people were talking about just SIBO in general on a plant-based diet. And the person says, Dr. Goldhamer, what benefits have you found fasting patients with either gastroparesis or SIBO?
Well, a lot of people have dysbiosis and they have disruption in the microbiome in their digestive system, or they have infection. And one of the great things about fasting is it's like taking a corrupted hard drive in a computer and rebooting it. And, just like you unplugged your video camera here just a few minutes ago and got things working, you turn the computer off, you turn it back on, you don't know why, but now it's working again. Well, fasting kind of is like that. It's you shut everything down, you turn it back on, put the right whole plant food diet in, you start growing back the right kind of bacteria, you get the right kind of waste products from those bacteria. So you're getting fertilizer instead of toxic waste. And generally can be very, very helpful.
Perfect. This question is about a specific condition in fasting, and maybe after you answer it or while you're answering it, you can talk about in general if there's certain conditions where people shouldn't fast. But somebody's asking, can someone with an AT3 antithrombin deficiency fast if they've been on warfarin for 49 years?
Yeah. So patients that are on anticoagulant therapy in general, as a relative contraindication to fasting, you would not fast on an anticoagulant drug unless you had very unusual circumstances and expert medical supervision. We do have a doctor on our staff, Peter Sultana, who's quite experienced at helping people in these really complicated medical management situations. And occasionally we have successfully used fasting in conjunction with anticoagulant therapy, but it's definitely a significant increased risk profile. Not recommended. Certainly not something somebody should be doing casually. And you don't want to just discontinue those medications suddenly either, because that discontinuation, if it's not done properly, can be associated with increased risk of stroke. So it's a complicated situation when people have atrial fibrillation or they've had a recent pulmonary embolism or DVT or have had a heart attack or stroke and they're on these drugs. Usually what we do is a modified version of fasting where people are on 600 calories of vegetable juice and broth and other things that we can use in conjunction with their medications. And then if necessary, appropriately modify or wean their medications as time goes on. In the case of some of the older anticoagulant therapies, you can do INR testing and kind of get an idea what's going on there. The newer drugs, that it's not monitored that way. So again, it's a more complicated individual medical situation. Generally, somebody who'd been on an anticoagulant for 49 years, water fasting wouldn't be the first thing that would come to mind.
Thank you. Yeah, because you can't be on really any medications, is my understanding, except for maybe thyroid medicine and fast. Is that correct?
Yeah, thyroid or hormone replacement therapies can sometimes be used safely. When people are on Coumadin, and it is possible to, as I said, monitor their INRs and regulate them if you have a doctor that's experienced enough. Dr. Sultana has been able to do that when it's been necessary to fast, but it's not possible to discontinue the Coumadin.
Thank you. All right. Okay. Can a mild case of psoriasis be cured at home with a whole food plant-based SOS-free diet and some level of fasting?
Well, psoriasis and plaque psoriasis and psoriatic arthritis do respond to fasting and dietary change. And anything that can be done inpatient can be done outpatient if it's done properly. So for people that are going to try to fast at home, they still need to follow the same protocols that we follow at the TrueNorth Health Center. They want to read Can Fasting Save Your Life? So they understand that. And the keys are that people have, one, be determined that they're a good candidate for fasting. And that means a medical history, a physical exam, and lab testing. It's the only way you know whether or not there are contraindications that would prevent fasting from being safe and effective. And then you need to have proper monitoring, which means if you're at home, you've got to have a doctor that's cooperative. If you're at the TrueNorth Health Center, of course, we monitor patients twice a day. And then the other thing they do is they're too active in fasting. You have to rest, whether you're at home or at the center, and you have to refeed properly. So not only the right foods, but you want to follow the protocol laid out in the book so that you don't get into refeeding syndrome or don't get into post-fasting edema or get into problems that happen when people don't terminate fasting according to our protocol.
Okay, thanks. Here's a question, because there's debate on whether heart disease can even be reversed in general. But the question is, can water fasting reverse heart disease? And can endothelial cells be repaired?
Yeah, in fact, we've heard a talk recently from Dr. Esselstyn in Ohio. He's talking a lot about how something even as simple as frequent amounts of steamed vegetables with a little balsamic vinegar increases nitrous oxide production and can be very helpful in people that are trying to recover from damage to their animal linings. So we know that diet and lifestyle change not only help prevent progression of cardiovascular disease, but also may facilitate reversal. Dean Ornish published a famous seminal paper in Lancet in 1980 showing that atherogenesis, atherosclerotic plaque buildup in the vessels, could be reversed with diet alone. We believe that fasting can actually speed that process even further. But as far as diet, there's no question that a whole plant food diet is going to be helpful for many people to begin reversing coronary artery disease. You're not really curing it though, AJ. You're just managing it, because you can't cure heart disease any more than you can cure obesity. You could lose the weight and keep it off, but if you go back to doing the things that cause it, it's coming back. And in fact, that's why the success rate in obesity is so abysmally low, that in treating BMIs over 40, the failure rate is almost 100%, 99.99% failure rate. And it's because people don't make the diet and lifestyle changes and then sustain the diet and lifestyle changes. They go back to the greasy, fatty, slimy processed crap that got them overweight to begin with.
Thank you. Okay, here's one. Dr. Goldhamer, can hypothyroidism be reversed by water-only fasting on a healthy, whole food, plant-based, SOS-free diet? This is a female asking the question.
Yeah, the most common cause of hypothyroidism is Hashimoto's thyroiditis. Those people often have what's called the HLA-DQ gene, which is the same gene that's associated with people that have gluten sensitivity. So one of the theories is by eliminating gluten as well as dairy proteins, you can oftentimes reduce the body's immune system from attacking itself. That's what hypothyroidism is. Your own immune system attacked your thyroid. And one of the triggers can be diet, and specific things in the diet that seem to stimulate the body to attack itself are gluten, wheat, rye, and barley sources of which, and also dairy proteins. So don't eat wheat, rye, barley, don't eat dairy, go on a whole plant food SOS-free diet. Now, if you've been on thyroid replacement therapy for 20 years, it's likely that you'll still need some level of thyroid replacement therapy, even if you're eating well, exercising, and sleeping properly. But it is true that many of our patients will reduce the amount of thyroid medication that they need in order to maintain normal thyroid levels. And that's important because the more thyroid you take, the more problems there are, including osteoporosis and other problems. And so you want to have normal thyroid function and you want to take medication if it's necessary, but no more than is necessary. And how much you need may depend on what you put in your mouth.
Thanks. So you have an upcoming study, I believe, and somebody's saying, when will you be collecting participants? And is this different than the high blood pressure study?
Yeah, we have a study that we've been planning for a long time. And it's basically a navigator study where we're going to enroll a large number of people, track them the rest of their lives, and determine whether a whole plant food diet and periodic fasting can avoid the last 20 years of debility that so many people experience. So that's essentially what we're going to do. We will announce that in our newsletter, and we will recruit, people for that study. And we think people will be interested in participating because there'll be a lot of benefits for people that are collaborating with us. So all you have to do is go onto our website, make sure you're signed up for our free newsletter, or if you've been to the center, you're automatically signed up for that. And we will announce it in the newsletter. And certainly, AJ, when we're ready to announce it, we'll come on your show and let people know what we're doing because we'll be all super excited about it. And they will have the option to signing up and collaborating. And we'll track them the rest of their life, provide them a lot of input, encouragement, and support. And we'll prove, hopefully, that a whole plant food diet, exercise, sleep, and periodic fasting is sufficient to give people the quality and quantity of life they want.
Thanks. Here's a question about fasting and osteoporosis. The person is asking if there are any bone density studies with prolonged fasting, and I guess what effect fasting may have on it.
Yeah, we did a study on that. We used the DEXA scanner. It was basically body composition study. So we wanted to find out what happens to the body when people go through long-term fasting. So we enrolled a large number of people. We did DEXA scanning before as baseline, after fasting, and then on follow-up. And basically what we found was that when people go on a fast, they lose weight, and then when they come off the fast, they gain weight. And the weight they lose in fasting is protein, fiber, water, glycogen, and fat. And the weight they gain as they come off the fast is protein, fiber, glycogen, water, but not fat. The fat continued to come off. And excitingly, at 6 weeks compared baseline, no change in bone density. There was no bone loss, bone mass lost on DEXA scan. What there was fat loss. And of the fat that was lost, it was interesting. These people lost an average of 10% of their body weight. They lost 20% of their total fat. And they lost almost 40% of their visceral fat, the type of fat that accumulates around the organs that produces inflammation that causes heart disease, cancer, diabetes, stroke, etc. And so the body was preferentially mobilizing the visceral fat over the other tissues. And it continued to do that even as people were regaining their water, fiber, glycogen, and protein. So basically what fasting did is it allowed the body to change its composition, to get rid of the health compromising visceral fat without compromising the bone density or without compromising long-term lean tissue.
Thanks. How can we fast intermittently while remaining physically active? For example, fasting 1 day water only versus 2 days of fasting or eating less than 500 calories a day.
Well, we don't recommend fasting more than 16 hours a day, unless you're going to do medically supervised water-only fasting where you rest, history exam, lab, and monitoring. So as far as the daily fasting up to 16 hours, that can be done without compromising people's medication use. They can continue to do their exercise. In fact, for people trying to lose weight, they may find by not eating 3 hours before they go to bed and then exercising in the morning before they eat their first meal, they may even preferentially mobilize a bit more fat than they would otherwise. And so we don't recommend 1 and 2 day fasting because it's biologically expensive without getting the benefit of the longer term fasting. So 16 hours every day and then periodically a longer fast of anywhere from 5 days to 40 days, depending on what's needed.
Okie doke. With vitamin D being fat soluble, does intaking a fatty acid food, for example, avocado, facilitate absorbability of vitamin D, or can absorbability be achieved with already stored fat?
Well, you do absorb whether you take fat or not, but you absorb at a higher rate if there's some fat in the meal, or is what's believed. I know for people, for example, if they have, a lot of people have a habit of they'll have one Brazil nut a day because they're trying to get selenium rich foods and whatnot. So if you do something like that, you might have your one nut, eat that, take your fat soluble vitamins, and you'll get maximum absorption. Or if you have foods like avocado, nuts, seeds, those kind of things, there's lots of, very, very fat wealthy foods that people eat in their diets. And that may enhance their absorption of fat soluble nutrients.
Okay. If you do a 40-day fast, how much time is spent before and after to get into the water fast with the food?
Well, that depends on if you want to have a pleasant experience or an intense, miserable experience. If you'd like to have a pleasant experience, you want to prepare before the fast by eating fruit, salads, and steamed vegetables only, and get rid of coffee, alcohol, caffeine, and anything else that gives you joy or comfort. We basically get rid of all those substances before people fast, so when they start fasting, they're just adapting to the fast, not having to go through all their drug withdrawals. And then after the fast, you need half the length of the fast in a controlled setting for refeeding. And if you do that, and we've done that 25,000 times, you do not get refeeding syndrome. You do not get post-fasting edema. You do not get the distress that people get when they inappropriately terminate fasting. And they do. I got news for you. The kind of people that are able to discipline themselves to eat properly after the fast are usually not the people that are struggling with weight control and the rest of it. So the characteristics that allow a person to eat the diet well are also the characteristics that are usually people that are able to do remote fasting successfully. People that struggle with weight usually are better in a controlled setting, in a contained environment.
Okay, and this is the last question from the people that attended the Live Your Best Life Conference Sunday, and thank you. And this is about the 5-2-day diet. It says that breakfast and lunch are defined by the time of day. I tried breakfast I don't really understand this question, and he's not.
Well, we can talk about the 5-2 pattern. This is where you're 1 day or 2 days consecutive or separated. You restrict your calorie intake to 500 or 600 calories. And there are lots of different ways to do that in terms of what you specifically eat. Honestly, AJ, the thing I found that works the best for most people is to fast 16 hours every day, eat 3 healthy whole plant food meals every day, salad, steamed vegetables dominated. If you're trying to lose weight, lots more salad and vegetables, not too much of the other stuff. If you're trying to gain weight, maybe not so much salad, more steamed and starchy vegetables. And that works well for both losing and gaining weight. If you're trying to lose weight, an 8-hour feeding window may make sense. If you're trying to gain weight, you may need a 12-hour feeding window. So you still don't eat 3 hours before you go to bed, but you might eat a little earlier in the day than a person who's trying to lose weight.
I think what he's asking is, should breakfast and lunch be based on the time of day? What are your suggested time frames for breakfast and lunch?
Well, it depends on if you're doing a 12 or a 16-hour fasting period. If you're doing a 12-hour window, let's say, for example, you go to bed at 10 o'clock and you subtract 3 or 4 hours from that, that means you're done eating by 6. So if on a 12-hour window, you would wake up, maybe you have breakfast, 6 or 7 in the morning. On a 16-hour window, you might have breakfast 9 or 10 o'clock. So it just depends on what your goals are and also how your life works. Some people, their life is, they've got to commute 2 hours a day to a job they hate and work with people they dislike for a company they detest, to make things they don't believe in, to make money they don't need, because they think that they're unhappy because they don't have enough short-term pleasure-seeking, self-indulgent behavior. Sometimes what people need to do is change their perspective and figure out what really is most important to them. And then maybe they don't have to compromise their habits as much because they have enough time to do things like get enough sleep, eat well, and exercise.
Okay, well, that was great. We got through all the questions from the conference, and we'll send this video out to everyone. And now we can get to the ones that were previously submitted. Please sign up.
Oh, wonderful.
You're great. You were really fast.
Well, I'm sorry we didn't get through those at the conference, but I was sharing the point with Dr. LIsle, and he tends to be very detailed in his explanations, and so he doesn't go through the quantity. he likes to say he's quality and I'm quantity.
Well, you're both awesome in your own unique ways. So it's best to
He
sign up.
was really on though. He started talking about some new stuff at your last conference. First time I've heard him going through some of those concepts, and they're coming out of his soon to be new book. So we're very excited that that's on the way.
Yep, I cannot wait for that. So if you go to chefaj.com, we send out a newsletter once a week because our shows have gone from daily to once a week now. And Dr. Lisle and Dr. Goldhamer both have regular slots. The best way is to submit a question there because then it stays on a special email and we keep it until it's asked. When you post it on the social media channels, they disappear right after the show. So the first question that was submitted in advance was from Megan and would like to know if you've ever seen schwannoma tumors shrink with water fasting. I've tried other whole food plant-based diet and so far no shrinkage. My schwannoma is on the cranial nerve 7 and pressing on cranial nerve 8.
Well, I don't think that we would expect to see a schwannoma disappear. Sometimes there's a mass effect where the swelling contributes to the compression, and that might be influenced. And the people that that talk about any of these neurologically mediated improvements, sometimes that turns out to be a reduction in mass effect, not necessarily the body breaking down the schwannoma itself. But again, I don't know that we have any published papers or data on that yet. So I wouldn't say certainly one way or the other, but I would be skeptical.
Okay, thank you. This is from Anonymous, and Anonymous writes, I'm always strictly whole food plant-based compliant for decades. I recovered greatly from SIBO simply by eating this way, but last year had to take antibiotics and have been back to recovering from SIBO bloating once again. Besides eating very healthily, is there anything else you would suggest to heal SIBO?
Yeah, well, fasting is fabulous because it can really help reboot the gut, especially if you've had to use antibiotics to treat an infection. Doing a period of fasting to kind of help recalibrate seems to be really helpful. And then really emphasizing high vegetable cellulose foods, the soluble fiber foods, so your raw and cooked vegetable materials, I think are really important to create an environment where the body can kind of get everything rebalanced. And then not doing sugars, all the different kinds of sugars and sweeteners, as well as dairy products, etc.
That's it?
Well, the other thing is medications can really cause havoc. And so some people are having trouble because they're using medications that are disrupting the gut microbiome. And, it's even possible, don't tell Dr. Lisle I said this, but it's possible that stress may have an influence on people as well. Because people that are under too much stress and have excess stress hormones seems to be able to throw a balance, out of whack. So I would suggest people not have excessive stress. And the way I suggest people do that is to try to focus only on things they can actually have some effect on and stop spending so much energy on things they have no control over. They can't influence. It's not going to matter whether they're stressed out about it or not. And instead put all of their energies into things that they might actually have some ability to actually affect.
Thank you. Okay, this is from Wendy. Dr. Goldhamer, could you please discuss any experience you've had with fasting stroke survivors? And specifically, have you seen anyone regain vision from a stroke either through fasting or a whole food, plant-exclusive, SOS-free diet?
Well, people do recover from stroke. Not all symptoms recover, and you don't know sometimes for a year or two how much recovery is going to happen. But that's the point of rehabilitation and therapy, where you continue to try to put input into the nervous systems to try to improve recolonization of the nerves. And so you don't know how much. Some people recover 100%, some people don't do a recovery at all. But you increase the odds of recovering by using diet and exercise and rehabilitation therapy to try to give the body the best chance possible to recover. The only real cure for stroke is prevention. So if you prevent the stroke, then you don't have to deal with the consequences. And that's why our colleague at the Mayo Clinic joined us, Dr. Scharf, where he spent his whole career as a neurologist treating people that had had strokes and trying to help them recover. And one day he said, well, what if we could prevent the stroke? And he saw our data on fasting came out. And that's how our studies on that we've published with those people have come about, because that one doctor had a personal experience and decided to implement it with his patients.
Thanks. Okay, we have a question From Michelle. I've been on a whole food plant-based diet for over 10 years, but recently experiencing worsening symptoms of acid reflux, GERD, and bloating. I tried betaine, which didn't help, and a PPI for one day, which worsened my symptoms. I'm particularly concerned about the risk of esophageal cancer and tooth erosion. Given the conflicting advice, my doctor, a naturopath, one suggesting PPIs and the other for high acid and others suggesting betaine for low acid, what steps can I take to prevent these serious complications and understanding why this is happening?
Well, if you are doing an exclusively whole plant food diet, most people will start getting improvement with this acid production issues, but not all people. For example, if you have active gastric ulcer disease, that may need to be treated before your body's going to be able to be successfully healing itself. If you've got an H. pylori infection, et cetera. What I would suggest, if you've done the diet and it's not getting the job done, I would consult with either Dr. Chilla Veres or Dr. Peter Sultana at the TrueNorth Health Center. They both have extensive experience helping people with serious GI imbalances, and they'll use both diet as well as, in some cases, a nutritional medicine approach where they'll give people precursors and things to help kind of rebuild an effective gut membrane, get those tight junctions to tighten up and improve the situation. And sometimes fasting can be an important part of an overall approach to dealing with chronic gastritis.
Thanks. Patricia would like to know if fasting and or a whole food plant-based diet can help with hyperparathyroidism or managing calcium. She has a high PTH and calcium number, which she's told.
Yeah, this is interesting because, there's a lot of people with tumors and masses out there, and some of them, their values have improved dramatically with fasting. Again, we don't have published studies on that, but I've seen enough patients clinically improve that I think there's something to it. I just don't know how to tell who's going to be the person that responds and who doesn't. Definitely worth a trial, though. And if they're interested, they can fill out those registration forms and call me. I'll be happy to talk to them about, trying to come up with a game plan that might be useful.
Thank you. Rob would like to know if shorter, frequent fasts are as effective as longer, less frequent fasts. For example, is doing several 24-hour fasts per week as beneficial as doing a 7-day fast once a year?
Yeah. So yeah, no, the answer is no. But short fasts can be very helpful, and sometimes that's all that's necessary. 16 hours every day is enough. The problem is it takes a few days to get into the fasting process. So doing doing 10 2-day fasts is nothing like doing a 20-day fast in terms of its clinical impact. There are some things you don't even see start changing until you're into the fast, 10 days, 2 weeks, et cetera. So depending on what your goals are for weight management or something, it's not relevant. But if your goal is to mobilize visceral fat, then a longer fast may have utility that several shorter fasts don't have. Even though you might lose the same amount of weight, the proportionality may be different. In terms of dealing with blood pressure or something, if diet and lifestyle alone doesn't work, then we would do fasting, but it's usually going to be longer term fasting, not just a day or two.
Thank you. This is from Becky, and she'd like to know what your opinion is about sugar-free electrolyte powder. She lives in the desert and exercises outside, and the electrolyte powders seem to help her during the hottest months, but she's concerned about the salt because she eats an SOS-free diet.
Well, I think that we should get all of our nutrients, our carbohydrates, our sodium, our minerals from our whole plant food diet. The one compromise I might see making is if a person, say, is trying to do athletic performance outside, they're sweating a lot, maybe they need to use some vegetable-based juices. But rather than taking the commercial high-sodium vegetable juices, I'd take something that's naturally higher in sodium, like carrot, celery, beet, apple juice, something of that nature. So again, it'd be a little bit closer to a whole foods. Might be processed in the form of juice, but I wouldn't resort to the chemical powders and whatnot that they're recommending through your commercial outlets. They're convenient, but I don't know that they're going to do as good a job to the body as using actual foods.
Well, she says that she exercises vigorously outdoors, and when she drinks plain water, she gets a headache, and wants to know the more healthy alternative.
Well, my guess is she's dehydrating, and so trying to help her avoid dehydration would be good. And if you're using, as I said, vegetable-based juices, I think you can get the fluid level in and still get the electrolytes and the extra glucose and stuff that you might need.
Thank you. Mary would like to know if you're familiar with Peyronie's disease, The doctors her husband's visited had no solution.
Well, I mean, Peyronie's disease is basically there's damage to the structural components of the penis, so there's curvature. And I believe there are some medical management techniques. I'm not familiar with the literature about how effective they are. But, you know, I would consult with a urologist and they can talk about what options they have medically. It's not a condition, because it's a structural condition, I wouldn't necessarily be thinking fasting or dietary change is going to have any profound effect on that. So I would, you know, talk to the urologist if there is any acceptable treatment medically if it's a concern.
Thank you. This is from Jody, and she said, this is a weird question. My son has an implantable cardio defibrillator, and he just bought a Tesla. Do you think the battery from the car could mess with the ICD? He said he's been feeling weird when he drives it now.
Well, I don't know of any reports that that's an issue, but again, you know, I'm not an expert in electromagnetic radiation influence, so I don't know for sure, but I would be surprised if that was an issue.
Well, what if he drives another car, you know, like right afterwards and see the
Well, that
comparison?
would be a worthwhile experiment. Drive a different car and see if it makes a difference. But
Yeah,
again, you know, I haven't seen reports that that would be a problem.
thanks. This is from Terry. Dr. Goldhamer, can fasting help with melanoma? My 44-year-old daughter is battling metastatic melanoma. She's currently in a clinical trial with immunotherapy and not having the results she or the doctor would like to see. I seldom hear any of the plant-based doctors talk about melanoma.
Yeah. So, you know, serious condition. There's some anecdotal reports, including in our book, our new book, Can Fasting Save Your Life? If you read the introduction, you'll hear some interesting stories. But as far as we don't have any published data specifically on melanoma, so the focus is getting people healthy, and that means diet, sleep, exercise, fasting. We certainly do that. And then in any of these cancers, you have to look at, is there any effective therapy out there? If there's an immunotherapy option, you know, that may be worth a consideration. But we don't, you know, other than the anecdotal stories that people are telling, we don't have any published data assessing the effectiveness of fasting in managing melanoma.
Thank you. Okay. This is from Anonymous, and it is about if HIV, can a person go to fasted True North without taking their daily medication, and would fasting for HIV help?
Yeah, so we have lots of patients that are HIV positive, and almost always their doctors that are managing their HIV medications have been comfortable with them taking a vacation while they're fasting in order to be able to do the fast. So we do fast patients successfully in terms of their clinical outcome is good. While they're fasting are able to discontinue their medications in most cases. We don't want to do this in conjunction, though, with the doctor that's prescribing those medications so that everybody's on the same page. But at least the last half a dozen cases we've had, there's not been any problem with the doctors. The outcomes have been good. And usually these are people that are not shedding virus. They don't appear to shed virus through the brief discontinuation of the medications.
And there's another question: if fasting can help with acute lymphoblastic leukemia.
Well, acute lymphoblastic leukemia is a serious condition, and it wouldn't in and of itself rule out the important use of fasting and diet. But again, we don't have published papers on lymphoblastic leukemia in terms of its effectiveness. The only papers that we've been publishing, and we have a case report and now a case series, is on lymphoma.
Wow, it'd be fun to talk to those people, Dr. Goldhamer. Do they ever do interviews?
Yeah, Yvonne has gone publicly, and she's talking, you know, you might talk to her. She might be willing to do an interview. I try not to bother my patients too much in that regard. You know, I really want them to focus their attention on doing the diet, sleep, and exercise, and not get involved in all the social interchange and social media. And also, sometimes when people do those, the people can be really cruel. I always tell them, don't read the comments, because they'll make really inappropriate comments about people that are really doing a fabulous job. And you know, they'll say that it's all paid actors and, you know, making up stuff, and you know, you don't need that.
Thank you.
Fortunately, I don't have a problem with it, because if you're on the spectrum and you don't care that much what other people think, then it doesn't seem to bother you. So for me, not a problem. But for a normal person, they don't like that. So I tell them to stay out of the limelight.
Thank you. This is from Anonymous. Can fasting cure sexually transmitted diseases? This person has HPV and she knows that some of the varieties can cause uterine cancer. She has a high-risk variety. She's a 26-year-old female, pretty healthy lifestyle, eating predominantly whole food plant-based. Could that alone cure it?
No, you're not curing anything with fasting. You can't cure obesity. You can't cure high blood pressure. You can't cure lymphoma. You can't cure anything. You can manage things sometimes, and it's true. Fasting and diet might improve the immune function to try to keep some of these things at check, but it's certainly not what we would consider a cure.
Okay. You're amazing. I think you're the only doctor that gets through all the questions in a session. These are the previously submitted. Oh, wait. Oh, finding more. Sorry about that. Well, we were close and we still have a few more minutes. Okay. So this is from, okay, this is from Carol. What do you think about food allergy testing, like the IgG foods test? I seem to react to a lot of foods and I'm having trouble figuring it out. I was on antibiotics as a teenager and a couple of years ago, so my gut health isn't the best.
Right. So, there's LCAT testing and IgG mediated testing. I haven't found them overwhelmingly helpful. Usually what they do is they tell people don't eat stuff that we already tell them not to eat: wheat, rye, barley, dairy products, sugar, etc., or foods that they have had repeat exposure to. So foods they're eating a lot of, so they develop, responses. So I don't have any problem with the testing. They don't do any harm. Sometimes they point to a food that we can then experiment with rotational feeding to see maybe they are sensitive to that food. What I prefer to do, though, is number one, start off by rebooting everything with a fast and get rid of the tight junction leakage and get the microbiome rebalanced, and then take the foods and do rotational feeding after the fast, where we introduce foods one at a time and watch for any untoward reactions. And then rotate food. Sometimes people can have fresh tomatoes once a week, but if they try to eat tomato sauce or they do tomatoes every day, they'll get a sensitivity or something. So, and if we do that, everybody gets better and their problem goes away, which they often do with fasting. The rashes and the hives and the sinusitis and the asthma and the psoriasis and a lot of this stuff goes away with fasting. And then with rotational whole plant food feeding, we can often keep it away. And if it doesn't respond well enough, or there's still some problem, yeah, we might resort to doing some of this expensive testing to try to see whether it gives us any clues or things to look at, in addition to just the general program that we do that works for a lot of people.
Thanks. This is from Jackie. Dr. Goldhamer, what are your thoughts on pain management without prescription medication, but possibly medical marijuana? My husband has stenosis and has had neck surgery for crushed vertebra and also bone on bone in his back. He eats plant-based and that has helped with inflammation, but he heard that a low THC and high CBD cannabis helps with pain. It is a natural plant.
Yeah. So I'm not a big pill potion guy. I'm not the person to talk about because I can't be objective to it. All I see is the negative. But I understand pain is a limiting factor. If people aren't sleeping, sometimes you have to resort to doing something to kind of help them sleep. But what I do then is I refer them to the people on my staff that are more competent than I am, which is like Dr. Peter Sultana, Dr. Anthony Strucker, or Chris Rule, who are licensed medical practitioners that can prescribe medication. A lot of times people say, well, THC is natural. Doesn't mean it's necessarily the most effective way of managing the problem, though. And so if you're going to have to use a pill, potion, or powder, I would recommend talking with a doctor that's, experienced and used to people getting well. And so I would refer them to them. And I'm not going to give advice about taking THC. Is that less bad than some other drug? What I'd be more interested in is finding out why are we having pain and what can we do to actually resolve it. If it's mechanical, let's see the chiropractor, the osteopath, the physical therapist, the massage therapist, and do exercise. If it's inflammatory, let's try fasting and diet to reduce the inflammation, actually deal with the cause of the problem. And if you have to use medication, that's a last resort as far as I'm concerned. And that would be in conjunction with a doctor that's efficient and effective at prescribing those. And my first preference would be the ones on the staff at the TrueNorth Health Center.
Thank you. This is from, what's your name? Kath. Dr. Goldhamer, I've often heard you say women are designed to be fat conservation machines. finding it harder to lose weight due to our hormones. However, I always used to find it quite easy to lose weight in my 30s and 40s. I discovered a whole food plant-based diet, and although not perfect all the time, it really worked well in managing my weight for many years, until I hit menopause at 50 and lost my hormones. Although my diet and activity didn't change, I started putting on weight, and it seemed no matter what I did, I couldn't shift it. And then earlier this year, I went on hormone replacement therapy. And although I still have to be eating pretty perfectly and pretty strict about my exercise, I've started losing excess fat again, over 28 pounds in 8 months. I'm now back at a healthy BMI, but I have another 17 pounds to go back to my premenopausal weight. So I don't know if I see an actual question there, but maybe you could.
Well, I think I got the idea, though. What's the deal here with this weight loss and aging? So yes, I say that women are energy conserving fat storage devices, biologically speaking, because they're designed to store fat to survive a period of biological vulnerability called pregnancy. That's why you have so much estrogen, which is a fat storage hormone. Whereas men have a bunch of testosterone, which is a fat burning hormone. It makes it easier for men to lose weight than it is for women, everything else being equal. And as people age, there are imbalances that can occur hormonally because the estradiol, for example, may not break down to estriol because the gut microbiome is altered because people were given antibiotics or they have liver congestion or whatever. So first, fix that. That's why we do the diet, sleep, exercise, and fasting. Sometimes post-fasting, that gut microbiome works better. The estradiol breaks down, the fibrocystic breast disease, the dysmenorrhea, the menorrhagia, the hot flashes go away. And then focus on the diet and lifestyle, and if necessary, nutritional medicine or even medications if necessary. But again, people are jumping to the medication before they've done all the other things, and so they never get a chance to actually get well. Most of my patients that go through menopause do so without it being a debilitating process. And they do it with diet and lifestyle control, not necessarily with drugs. For those that do need drugs, at least we can minimize the side effect from the medication by getting them to do the diet and lifestyle stuff, and as soon as possible, get them off of them.
Thanks. Okay, let's see. Here's a question from Sandy. And she would like to know if you could give an ideal day of eating. Many of the opinions differ regarding the amount of overt fats, the volume of food, the starch source, grazing versus solid meals. Can you please give us your version of an ideal day and include approximate volumes that you would consider minimums?
Sure.
And I understand we should stay away from the weighing and measuring and portion control. But for those of us who struggle to recognize hunger and fullness signals, would this day include eating an omega-3 source of fat? And would you favor legumes over whole grains or potatoes? I would love to hear this from the plant-based king himself.
Okay, it depends on who you're talking about. Male, female, underweight, overweight, healthy, not healthy, old, young. Because there's a huge difference. Think about it. An 86-year-old passive female that weighs 100 pounds has different needs than the 26-year-old roofer male burning 3,500 calories a day, compared to say 1,600 calories or 1,800 calories for the older, more passive female. So let's not pretend that there's one exact quantity of food that's going to meet everybody's ideal needs. But what I would suggest is generally, you want to get, at least half your volume for most people, fruits and vegetables, raw fruits and vegetables. So we might have one meal that has a bunch of fruit in it and two meals that have a lot of greens, so salad and steamed vegetables. How do you know if you have enough salad? If you don't have a scale to weigh out, say, a pound of salad, you just make your salad bowl up and put it down on the table and wait for people at work to walk into the lunchroom. And when they see your salad, if they go, "Oh my gosh, you're not going to eat all that," you're probably okay. If they don't react with shock and awe, you probably didn't get a big enough bucket. Steamed vegetables, big platter of steamed vegetables. Again, you might have steamed vegetables a couple times a day. It could be greens, it could be broccoli, cauliflower, collards, could be a variety, it could be just one. And then just enough complex carbohydrates, whether it's beans or grains, not necessarily a critical issue, or starchy vegetables if you don't want to use beans and grains, but enough so that you're maintaining optimum weight. So how much is that? Well, it depends on how active you are and how old you are and how, what you're doing. So for, I can talk about myself. I weigh the same weight I've weighed since I was been in high school. I eat about the same amount of calories that I, on a day-to-day basis. In the morning, I'd have oatmeal. I'd have fresh fruit. So we might talk about a cup or two of oatmeal. We're talking about 2 or 3 pieces of whole fruit, or it might be some melons or berries or whatever, and an ounce of nuts or seeds. So it might be walnuts, or it might be a Brazil nut in there, and a B12 supplement. So liquid B12, 1,000 micrograms. That might be a typical breakfast. Maybe a different day, instead of oatmeal, it might be a cornmeal, or it might be some steamed potatoes, or it might be steamed vegetables. Lunch and dinner, always have a big salad. I always have steamed vegetables. And then I have some kind of complex carbohydrates. And I would get either a plain potato, rice, or I'd go to one of the cookbooks that's vegan SOS free. It might be AJ's cookbook. It might be Kathy's Straight Up Cooking, which is excellent, or Ramses's Bravo or Bravo Express, or our original health promoting cookbook. We pick something. If you don't want to have something plain, make a dish using predominantly starchy vegetables or grains or legumes. I'm fortunate I live in California, where we have ready access of fabulous stuff all year round. I work at the TrueNorth Health Center, where we have these fabulous chefs that make a variety of foods all the time. So it's really easy for me. It's harder for people that have to shop and chop. Fortunately, now there's companies out there like Whole Harvest and Well Your World and First Seeds that'll make vegan SOS-free foods if you request the SOS-free option, and actually ship it right to you, so that you don't have to make each and every meal all week long, and you can still get access to whole plant food, SOS-free food. So it's getting easier. I didn't say it's easy, but it's getting easier to find some actual food. And even restaurants now, sometimes they'll have an option that will be a SOS-free food option. So, hopefully in time it'll get easier.
Great. Well, Dr. Goldhamer, we have so many more questions in the chat and on the various social media platforms have sent in, but I want to respect your time. You've gone an hour, but you're going to be coming back next month for a
Excellent.
the second Wednesday of the month at 11 a.m. Pacific time, or maybe it'll be 10 or 9. You'll decide the time that is best for you for Can Fasting Save Your Life? If you haven't picked up this book, there'll be a link in the show notes. You can they still get an autographed copy if they buy it from
Yes.
the Health Center?
Yeah, we have copies right now. If they just make that request, they'll make sure that they get one that we have there. We have dual author copies of the book still. So while those last, we'll still be happy to send that out. Just make a request when you put it in there, and they'll make sure they pull one of those out.
Great. And if you love hearing Dr. Goldhamer answer questions and want to hear him answer questions for 3 hours straight, there'll be a link to join the Ultimate Reboot program, which starts in a few weeks. Thanks so much, Dr. Goldhamer. This was great.
Okay, well, thank you, AJ, and thanks for getting the message out.
Absolutely. And thanks to all of you for watching Chef AJ and Friends. Please come back next week. That would be Friday, July 19th for The Doctor Is In, a Q&A with Dr. Ron Weiss. Take care, Dr.